This video continues Chapter 12 of OEC 6, looking at substance abuse and poisoning. And we're going to look at several commonly abused substances, and we're going to categorize them into about 15 categories. We'll look a little bit at the signs and symptoms of those things, but principally right here we'll list and describe categories of commonly abused substances. So the first category to consider is going to be just tied to this idea of what is substance abuse. And it's an intentional misuse of a substance that results in impairment or physical harm. We can look at categories of substances and consider them to be therapeutic. It's the intentional misuse that sets this apart. Young adults are particularly at risk, but then we also want to consider the possibility of addictive dependence that may occur due to substance abuse. So addiction is a true medical illness, and that occurs when that individual's body craves the substance, and absence can lead to withdrawal, which can have both physical effects and mental effects accompanied with stopping usage of the substance. So drugs approved by the FDA have legitimate medical uses. It's when they're taken not as directed that we move towards the idea of substance abuse. The line between it being therapeutic and it being toxic is a fine one. And in some cases, overdose can occur if the dose is very, very, very high. Let's move on and define a different term, which is poisoning. Poisoning is this toxicological event resulting in injury or illness following exposure. And any poison is a substance that has harmful effects when introduced. A toxin is a specific poison that comes from a living organism. So a toxicological event is resulting from exposure to that harmful substance, either intentionally or unintentionally, and the resultant medical emergency. Keep in mind, overdoses and poisonings can be accidental or they can be intentional. Let's look at our categories. We have 15, but as a quick review, let's look at once again the routes for absorption of a substance or a poison into the body. Remember, ingested poisons enter through the mouth and the digestive tract specifically, although we can look at the mucous membranes of the mouth as well. Inhaled poisons enter the body through the lungs. Injected poisons cross that skin barrier directly into a vein or perhaps subcutaneous or muscle tissue. And transdermal poisons are absorbed through the skin. The first category to consider is acids and bases. And we can have poisoning due to ingestion, typically of an acid or a base, such as we might find in a household situation in a cleaning solution. Most of those are basic. It's more effective for cleaning up dirt and grease. Now we're going to have direct tissue damage, chemical burns as a result, especially to the respiratory tract and the GI tract, the upper part of that to be specific. A second category is an anti-anxiety drugs. And an anti-anxiety drug helps a patient in a therapeutic dose with anxious feelings, such as they may encounter with a particular panic disorder. We can encounter these in our sample history. If you ask a person what medications they're on and they respond with Valium or Xanax or Ativan, if you don't remember that's an anti-anxiety drug, remember the follow-up question to sample history is, hey, what do you take that for? Antidepressants are used to treat depression, and some older ones, such as Elavil, were part of a category called a tricyclic, and they have some toxicity to the heart. Newer drugs tend to be safer. These things would include Zoloft or Prozac, but possibilities for alterations in mental status or a heart arrhythmia can still occur. Antipsychotic drugs or tranquilizers are used for further psychiatric diagnoses, in this case specific psychoses, And overdose can lead to low blood pressure or disruption in the heart's conduction system, and therefore leading to an arrhythmia, an irregular heartbeat. We may also see abnormal muscle tone from use of these drugs. One of these that you may encounter is thorazine. Depressants are a class of drugs that lower CNS activity. So alcohol is the most commonly abused drug in the United States, but we have this category of opioids that has the similar effect. And so we'll see sedation or respiratory depression, slowing of the respiratory rate, and consequently, in the case of an overdose, that respiratory depression can lead to death. Designer drugs are what we may encounter with the particular population of young adults. They're going to impair brain function and can be very dangerous when combined with alcohol because they can lead to profound sedation and amnesia. We may hear about this, for example, with roofies or rohypnol, which is a date rape drug, or GHB. Some of these substances are made illegally, that's the designer piece, but others could be a prescription medication. Hallucinogens are also encountered, and these distort your sensory perceptions. We may encounter LSD or PCP, or ketamine is growing in terms of its usage as well. Inhalants are chemical vapors from common household products. A lot of these kind of belong in this category of being cleaning solvents. And so we get similar effects to alcohol intoxication from people who do some huffing, but the long-term effects, such as permanent brain damage, which is tied to the loss of sensation that you feel from this inhalation, is something that these patients or you as a responder should be aware of. Nerve agents are a special category that we would only see, for example, in chemical warfare. These substances will interrupt nerve impulses and consequently lead to seizures and respiratory distress. This poisoning would occur through inhalation or transdermally, and sarin or VX are common nerve agents. Well, not that common, but in warfare, possibly. Opioids, we mentioned earlier when we talked about the class of drugs that are depressants, but they're derived from opium or synthetically made, and so they're opium-like. Now, medically, therapeutically, they can be used to relieve pain. Think about morphine, but they also consequently can affect mood and emotion. And so something that may be used therapeutically, this is a synthetic fentanyl, can be misused, and some of the effects of that, the CNS depression that can result, will lead to the idea of respiratory depression and death. Opioid addiction is sadly something that we're encountering more and more in emergency medicine. Some common prescription opioids that can be abused include oxycodone or hydrocodone, or meperidine, which is the generic name for Demerol. Organophosphates are those chemicals that we find in insecticides, pesticides, and herbicides. So we think of this more in the idea of it being poisoning. It's certainly not going to be, hopefully, a substance abuse problem, but inhalation or transdermal absorption can lead to symptoms that are very similar to nerve agents. Organophosphate poisoning can lead to that respiratory depression and eventually to death in the case of an overdose. Over-the-counter medications can be overdosed or abused as well. Cough medicines may be abused by adolescents, and so the ingredients that are there can actually lead to, in higher doses, hallucinations, but then also something like an arrhythmia because of its CNS effects. Prescription drugs are drugs ordered by a physician intentionally for their therapeutic effects, but they may have toxic effects if taken in excess. Almost all prescription meds have harmful effects if they are misused. There's a saying, the dose makes the poison. For some medications, the therapeutic dose is close to the lethal dose, especially around heart and blood pressure meds. So we have to be mindful of those as we take a sample history. Overdose can be accidental and can occur just if a person shares a medication with spouse or other family member, especially if there's a size difference. Lots of times therapeutic dose is calculated milligrams of medication per kilogram of body weight of the patient. Prescription drug overdose can be common among elderly patients. One of our last categories are sedatives, such as phenobarbital, and those help people relax. They may function as a sleep medication. But again, that overdose is going to depress the central nervous system and again lead to respiratory depression. Stimulants are the last category to consider, and they have this effect of increasing CNS activity. And so the excitement and agitation can lead to erratic or dangerous behavior and in possibly extremely high blood pressures, which can then lead to stroke. Examples of stimulants include meth, cocaine, or crack.